No one can make it better than you. You have the world at your fingertips. See what they've done to the rain and the sun. So many changes have all just begun to reap. I know you must sleep. Wake up. Nature's way of telling you something's wrong. It's nature's way of telling you in a song. It's nature's way of retrieving you. It's nature's way of receiving you. It's nature's way of telling you something's wrong. Nature's way of telling you, listen please. It's nature's way of telling you, it's your disease. It's nature's way of healing you. It's nature's way of revealing you. Yeah, it's nature's way of telling you something's wrong. It's nature's way, it's nature's way. It's nature's way, it's nature's way. It's nature's way of telling you, listen please. It's nature's way of telling you, it's your disease. Yeah, it's nature's way of healing you. It's nature's way of revealing you. Yeah, it's nature's way of telling you something's wrong. Something's wrong. Something's wrong. Oh, oh, oh. Keeping it real about your health. I'm Dr. Mark Walcott. Good evening. I'm Dr. Mark Walcott, and I'm keeping it real about your health. Now, tonight we have a very special guest with us, a wonderful lady I've just had the privilege to meet a little while ago. Her name is Joyce Hamlin, and she works as a cardiac technician at Cape Cod Hospital, and she's been there for over 32 years?
33.
Can you tell us a little, what brought you into that profession initially, if you wouldn't mind?
My daughter.
Really?
Yes. I started out at Cape Cod Hospital as a summer job, and there was an opening for a full-time permanent position, and I decided that since Cape Cod Hospital carried health insurance and my daughter was accident prone, I should stay there and have the insurance company pay her bills rather than me. If she was in the emergency room at least 3 times a year. She's accident prone.
Really?
Mm.
Well, I see. That's very interesting. So this has been a heroic effort, but
Yes.
it certainly has been on your part.
But I love my job.
You love your job.
I
You
love
get
my
to
job.
get to work with people
Mhm.
and help people in a very positive way.
Oh, I do, very much so.
That's excellent.
Yes, we believe in touching and hugging and everything.
Yeah, hands-on.
Yes.
Hands-on. Now, just a moment ago, you were telling me that there's a new coalition in the hospital of some holistic practitioners that you heard about.
The hospital is going in that direction very much. We have massage therapy, we have deep muscle therapy with one of the physical therapists. That's her specialty. We have acupuncturists, chiropractors that you can be referred to through the hospital. It's really getting quite good because Eastern medicine and holistic medicine and shamans and whatever, they all work. It's all in conjunction.
Yes, that's a very good point. In fact, that's one of the elements we talked about in my last show, about one aspect of health is a positive outlook, affirmations, the power of prayer, things like that to get you through, because that can bring us through rough times.
In the area that I work in, all the technicians work very well together, and we're always kidding and joking around. And it's amazing, the patients come in and they're white when they come in, and when they go out they're pink. Because they've calmed down so much and we've relaxed them so much.
I'm sure you've saved a number of lives in that way too.
You.
I was really impressed with the new wing that was just opened at the hospital recently.
Gosh, yes.
Those are like luxury suites there.
There is one luxury suite. It actually has a boardroom right off of it on the balcony. You go way down the hall and then to the left, I believe.
Boy, I wonder what. Okay, that would be luxury accommodations in any city,
Yes.
certainly rivaling
But,
the plaza.
Their new rooms have beds that make couches that make into beds so that a family member can stay with you if you want. The rooms are absolutely gorgeous. You don't see a lot of traffic in the hallways anymore because everything is behind the scenes. All the traffic with the linen and the cleaning and.
Yeah. And it has a great view of the harbor.
Yes, it does. It's gorgeous.
Well, you know, it's certainly been a pleasure talking to you tonight. And you know,
it was nice meeting you too.
Well, you know, let's talk again sometime.
Okay. We will.
And so this is Dr. Mark Walcott from Keeping It Real About Your Health, and we'll see you next time. Keep it real. Good evening. I'm Dr. Mark Walcott, and welcome to Keeping It Real About Your Health. Tonight, we're going to have a great show. We have some very talented musical guests. In fact, without further ado, I'd like to introduce the Ticks.
Cornelius, light snow, Kris Kringle, wreaths of mistletoe. Westbound bound, all those lights around us. Ba-la-la, ba-la-la, ba-la-la-la, ba-la-la, 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 ba-la-la-la-la. Oh, my back hurts.
Hello again. I'm here with my good friends, the Ticks, and I'd like to introduce everybody to you, the members of the band. This is Emma.
Hi, I'm Emma Dubner. How
And-
are you?
I'm great, thank you, and good to see you too. Glad to have you all here. This is Julia,
Hi, how you doing? I'm Julia Randall.
and this is Sue.
Hi.
And great. How long have you been playing together as a group?
We've been playing together since 2000, the year 2000.
The entire millennium so far.
Yes.
Fantastic, fantastic. I know that you annually, when the Beachcomber opens up, usually you're the opening act for them, which is really great. So-
That's not going to happen this year.
Oh, really? Oh, I'm sorry to hear that.
We're having birthing issues with that. The
All right.
timing is a little off.
I understand completely. Well, at least from a male point of view. So tell me a little bit about, this is a show about natural health, and I wanted to get your take on, what do you do in your own lives in terms of staying healthy? For example, I understand you see a chiropractor regularly.
I do. Well, I've seen a chiropractor on and off, and now I see one regularly because my body's changing a little bit, and my back is killing me. My sciatica is crazy, and I have been going to a chiropractor since I was a kid. My mother was big into homeopathy, so.
Excellent, excellent. And that's very congruent with the philosophy of chiropractic, the idea of like cures like. We heal from the inside out, from the top down. Julia, what about you?
Well, I've been going to the chiropractor for about, I'm not sure,
I think
like 8 or 9
maybe
months or something.
almost a year, actually. I
Yeah, and I was discouraged as a child from visiting chiropractors. My father, and he's a doctor and he knows what he's talking about, but he has a really bad back, and he kind of tried to dissuade me from this course. But Dad changed my life. I don't know what camera is. Dad changed my life for the better. It's so much better now. Also, in my everyday life, not every day I should, but I practice yoga.
Excellent.
And I'm studying to be a yoga teacher. I'm taking a training course. So
That's fantastic. That also works very well with chiropractic. I mean, once chiropractic helps to free the nervous system and the joints up, then yoga is a very good means of maintaining that flexibility.
that is the case.
Excellent. So how about you?
Well, I have very poor posture. And, but your question was actually, what do you do to stay healthy? Which is, I garden, I'm a landscaper, and that actually, while it keeps you mentally healthy and you're physically healthy, it does cause a lot of problems on the back. For example, I was just cleaning Julia's parents' yard the other day. Wonderful people, by the way. But boy, did I hurt my back. Oh, boy, did I hurt my back. And I've never been to a chiropractor, and I've heard so many good things from Julia about.
We'll just have to remedy that.
But it's the back is a terrible thing we take it for granted, and we need our backs.
Absolutely. It's what keeps us upright. So what I thought we'd do, we're going to have a little fun tonight. Julia has volunteered to actually allow me to adjust her in front of the camera. But before we do that, I'm going to show you that, chiropractic is both a science and an art. And I'm going to show how we came about being able to figure out what to adjust. It isn't just a matter of going in and picking a vertebrae and adjusting it. So there is a method to this, and I'd like to do that right now and give you a little bit of a take on how we determine where subluxation is, which we talked about on our last show. So if you hold on for a moment, we'll get it set up for that.
Hold on,
Yes.
before we do that, hold my mic. Hi, well, we wanted to present you with your very own Tick t-shirt,
Oh my God.
okay? And if this isn't the right size, we brought other sizes, but we
Oh, I'm just
We'd
thrilled.
like to say thank you, Dr.
show the
Mark.
logo.
And I want to say
Show the
thank you
logo.
too. I really have coveted one of these shirts. You know, these shirts get around. A good friend of mine, actually, I saw this shirt in Maine, way up in Brunswick. I said, how do you get that shirt? Well, he used to live on Nantucket, and then he saw the Ticks play at the Beachcomber, and he bought a shirt, and I said, oh, that's great. So I'm thrilled. Thank you so much. Really appreciate it.
You're welcome.
And Jim, who's a crew member here, designed the shirt.
We are deeply indebted to Jim. Shall I say grateful, indebted, grateful to Jim, because he not only is he helping with the technical crew, as all these other gentlemen are who are helping right now. We're very thankful for the whole crews here, and Alicia, who's going to help edit this, put it all together. And so he was the designer of this. Jim actually designed this shirt, and I think it's fabulous. And it's all about merchandising, so that's great. Okay, so we'll take a break here for a moment, and then we're going to have some fun showing about how to adjust. So I'll be back with you in a moment.
Thanks.
Tonight, we're going to look at how I determine where there is a subluxation and where to adjust in the spine. So I just happen to have some films that were taken they were taken about a year ago by myself of a patient, and I'm also going to show you the electronic means that we determine where there's a subluxation. In our office, we have a computerized device known as a subluxation station. It has two components. It has a thermographic imaging device and also an electromyographic device, or EMG. And these are all non-invasive. They detect energy coming from the body in terms of heat energy and in terms of electrical energy from the muscles. So first, what we did is when we did an electronic scan, I'd like to point out here, there is the scan shows us, you see there are these little white bars here. These represent abnormal muscle signals that are coming from the spine as a result of pinched nerves. This very center scan is what a normal spine should look like. Now over here, this is the scan of the patient, and it shows there's a red bar up here, and there's a red bar at the very top of the spine. Red means severe nerve impingement. And then over here, there's a blue bar. That means moderate nerve impingement. So anywhere where you see these bars means that corresponds to an area of the spine where there was a fixation or a subluxation. And then this scan over here shows there's muscle imbalance or muscle asymmetry. Where you see these little look like arrows or pennants, that shows that the muscles are pulling too hard on one side. Therefore, that's a muscle asymmetry, a muscle imbalance. So in this patient, there was problems up in the neck, mid-back, and all the way down into the lower back. Then our third means of assessing the spine through the thermographic imaging, this showed that there are abnormal signals both up in the neck area and down the lower back. And this corresponded pretty much to the patient's symptoms. So we use this information to help determine where to adjust and if the patient needs to be adjusted. Now, over here, we took films of that patient. And there's actually one film I'm going to show you. This was that patient. It shows that she had a loss of, or actually a reverse curve in the neck. This is a film of a patient with a normal neck. You see, I told you last time, the last show, that normally there should be a curve in the neck that bends forward. The purpose of the curve is to help distribute the weight of the head evenly across the whole spine and the cervical spine. But when there's a loss of curve, or worse, when there's a reversal of the curve, that means that the force of gravity is bearing down on these discs, and over a period of time, these discs can get compressed and eventually lead to osteoarthritis. So this tells me that in terms of mechanical correction, that we needed to adjust the spine and try to bring it back to the normal curve as presented here. And that's pretty much what we do. We also utilize information in terms of standard orthopedics like range of motion, reflexes, etc. And so now I'm going to actually adjust a patient. So let's go back here. So that's the kind of information we use. We try to be objective. We also take a very thorough case history of the patient, any past trauma, particularly car accidents, slip and falls. And this can go all the way back to birth trauma, believe it or not. And if there was birth trauma, early childhood injury, things like that. All these are imprinted on the spine, or can be at an early age. So that's why it's important to find out exactly what's happened in the early days, developmental days, plus things that might have just happened last week in terms of maybe raking the lawn the wrong way or sleeping the wrong way. So this is the kind of information we utilize in our office every day. And probably in the next show, we'll actually do a real-life scan with a patient and showing the technology. So now, without further ado, I'd like to show how we adjust a patient. Okay. Hi. Now, Julia has kindly consented to allow me to adjust her on air, and I think that's fantastic. Let me show you what we use for adjusting, because I know a lot of people have misconceptions about chiropractic and, oh my God, they're going to twist my neck and what's going to happen. Well, in our office, we do hands-on adjusting, but we also use a little instrument. It's known as an activator. This is what it looks like. And it's a little spring-loaded device with a rubber tip. Delivers very light force adjustment, but very quick. And this is just a little demonstrator to show you that when we make an adjustment, see how it can move that marble up and back and forth like that. So, but the vertebrae will not bounce around like that marble. They will because there are ligaments and muscles attached. So it's very gentle. We use this for children. We use this for little old ladies, people with osteoporosis. In fact, this is all that my wife and I use for adjusting each other. So without further ado, Julia would be so kind as to lie face down here.
I don't get to do the ride on the table?
No ride on the table. We do have a ride at table in our office. Now, very interesting how we do this. What we do in this technique is we check what are leg length. Now, most people think, well, you know, are their legs even? They don't think about whether the legs are even or not. And there are two different kinds of short legs. As I'm checking Julia right now, I notice that the right leg is short by maybe about 1/4 inch. And I bring it up and we check and it stays short. So the body has like a code, a way innately it's trying to communicate with us about where the adjustment has to be done. So with a short leg staying short like this tells me that one of two possibilities, either the problem's in the sacrum or it's L4, most likely L4. Why? Because, well, I've worked with Julia before. So we're going to palpate and find L4 vertebrae. Is that any tenderness in there, Julia? Not too bad? A little bit? So we're going to just use an adjustment like that. Okay, now we check the legs again, and the legs are even. Good. So the system works. Now, the next thing we'll do is check the hips and pelvis. So we pull down on the sacroiliac joint, we check. It's like asking the body, is there a problem in this area? And everything's fine so far. Now place your right arm behind your back, please. Okay, and now place both arms behind your back. And both arms at your sides. We just checked L2. Now place your right arm above your head, please. This is a check for the 12th thoracic. That's good. Now the other arm up, so both arms are above your head. Legs are still even. That means there's no subluxation there. Put your arms back at your sides and turn your face toward the right. Now this is a check for an area where a lot of people have problems up in the 6th thoracic vertebrae. So when she did that, the right leg went short and it stayed short. So that tells us we have to adjust on the left side. Now is that a little tender like right in there? Okay, so we adjust there and then we have to go to the rib on the opposite side. Okay. Now the next thing we're going to do, I'm going to have you lift your shoulder up off the table and then put it back down. And that's fine. Shrug both your shoulders up and then relax. That checks T1, the 1st thoracic. Now squeeze your right arm against your side and then relax it. Squeeze the left arm against your side and then relax. That checks the shoulder blades. Now the leg went short when I checked the left shoulder blade for Julia, and so that tells me we have to adjust the shoulder blade. So we go on the outside of the scapula, we go there, and then down on the arm, and we have to cover the whole area, including the elbow, because the nerves are all connected, and then down into the wrist. This helps many times people with carpal tunnel syndrome. Now, keeping your head that way, place your right arm above your head, and then put it back at your side, and that test is for checking the 2nd thoracic. Okay, turn your head straight down, please. A lot of times people, when they have chronic history of heart problems, not that Julia does, or arm pain, but some of my patients do, and many times the 2nd thoracic is subluxated. And how does that relate to the heart? Well, the nerves that come out from T2 can go to they actually go to the heart. Okay, now lift your head up off the table and put it back down. And that's a check for the 5th cervical. That's a very important vertebrae in that that's the key to the spine. Remember I told you about the loss of the cervical curve? Well, many times the first vertebrae that misaligns when there's a loss of the curve is the 5th cervical. So we just do a light adjustment there. Okay, and we check again. Try lifting your head again. And then put it back. Now tuck your chin toward your chest, please, and then straight down again. And that caused the leg to go short, and it stayed short. So that's a clue that tells me that there may be a problem up here. Is that a little tender up there in the second? That's the 2nd cervical vertebrae. Many times when that's subluxated, that can cause problems with headaches, ear problems, sight, vision problems, things like that. Okay, and just gently push your head straight down and then relax. Any other areas of concern, Julia, that we should look at? Or no. So far, so good. Great. Then I think we're done. You're all set. You can come back up. All right. You are adjusted.
Woo, thanks.
My pleasure.
Feel great.
So I hope you enjoyed the show tonight, and looking forward to having the Ticks back on eventually someday. And they're a great group, aren't they? Absolutely. So have a great evening. And why we're here? Because we're getting real about your health. And she has the highest rate. Good evening, folks.
Thank you.
Thank you. And now, once again, the Ticks.
I got up to dig out one day a week. When the boy gets home and go to the beach. Can't wait to see him. Now that he's out of reach. That boy's alright. That boy's alright. That boy's alright. That boy's alright.
Thank you. Oh, my back!
Tell me, brothers, what is real? What's the deal? What's the deal? Tell me, sisters, what is real? Ain't no weapons of mass destruction. And Janie's got his hands in Reconstruction. I can tell by the yellow in your bloodshot eyes. Even all big farmers' lies now. Tell me, sisters, what is real? What's the deal? What's the deal? Tell me, brothers, what is real? Yeah, keeping it real about your health. Okay. I'm Dr. Mark Walcott, and I'm keeping it real about your health.